Hey guys, it's your boy Be Rich. Gonna hit you up with another video. Let's talk about eczema, atopic dermatitis. Pretty much it's the itch that rashes. So pretty much someone has an itch, they scratch, they develop a rash. The itch that rashes, just remember that. So this is a chronic condition. You're gonna see these patients over and over again. Come to the clinic, emergency room, primary care, wherever you are. Usually starts in early infancy, and it's an inherited condition. Usually the skin's ability to provide that protective barrier, it's impaired. So they have dry skin starts to crack, and you start to have some crusting. The environment, stress, contact, like with nickel, sweating, heat, dry environment, wearing occlusive headgear. So when people come in, they're gonna, expect you to give them some type of medication. You're gonna ask them, hey, have they used anything over the counter? Most of them are gonna say yes, but what have they really used? What have they tried? How are they using it? You want to get to the bottom of this. Patient education in this instance is very critical. It can prevent them from numerous visits to the urgent care, to the emergency room, once they get an understanding of this condition. So what are some topical things that you can give, like some mild topical steroids such as hydrocortisone, which you can get over the counter 1%, but in extreme cases you can even prescribe up to 2.5%. Or some medium topical steroids you can prescribe are triamcinolone ointment, 0.1% cream, or the ointment. This can help with the itching tremendously. This is my go-to, triamcinolone ointment. Now steroids can help with the itching, but also you can also give systemic oral antihistamines. That will help with the itching as well. Most of the parents will tell you that they took Benadryl. You can also suggest or prescribe for them hydroxyzine or cetirizine or Zyrtec, which they can get over the counter. The Zyrtec is less drowsy, so it has less sedative effects, and usually that's what I like to go with. But the antihistamines really don't help. They have little effect on the pruritus of the issue, so no, they won't really help with the itching much, but they will help with sleeping, especially at night. Kids tend to scratch a lot when they're asleep, and you want to prevent that. You want to prevent too much scratching. You want to prevent infections from developing. With the hydroxyzine, just remember the dosages. It's always hard when someone says, I'll give hydroxyzine. You're like, how much? Especially with a kid, So hydroxyzine, you want to go with 2 milligrams per kilogram per day, and you can divide that into like 6 to 8, every 6 to 8 hours. So 4 to 3 times a day. Hydroxyzine, 2 milligrams per kilogram per day. Benadryl, that's another tough one, Benadryl, 2 to 6 years old, remember, go 6.25 milligrams every 4 to 6 hours. Maximum dose of Benadryl is 37.5 milligrams a day for 2 to 6 years old. Remember that, okay? 6 to 12 years old, 12.5 to 25 milligrams every 4 to 6 hours. Maximum for 6 to 12-year-olds is 150 milligrams a day of Benadryl. Older than 12 years old, you can give 25 to 50 milligrams of Benadryl every 4 to 6 hours, and that's max is 300 milligrams a day of Benadryl. Okay. Now the kicker is you're gonna get these 6-month-olds come in, and the parents are gonna be like, how much Benadryl do I give them? So any kid younger than 2 years old, you want to give them Benadryl 1.25 milligrams per kilogram per day, okay, or 1 to 2 milligrams per kilogram per day. Maximum dose is 37 milligrams per day for kiddo less than 2 years. And you want to talk to them about the sedative effects of Benadryl. And then patient education, okay. You want to educate them about how to moisten the skin and how to avoid scratching. So some skin lubricants that these parents can use is, for example, some Vaseline, Intensive Care Deep Moisturizer, Purell as well, Ultra Healing. These are all about $4 or $5 over the counter. Aquaphor. What I talk to the parents about is to avoid hot baths like harsh soaps, fabric softeners, bleach, stuffy animals, feathery toys, stuffed animals, dust in the house. How's the house? What kind of environment is a kid living in? Is it a dusty house? These all can cause these flare-ups, like non-breathable fabric, such as nylon or wool clothing. So look at the kind of clothing the kids wearing when they come in, when you're examining them. Do they have wool clothing? Do they have nylon? You want to talk to the parents about this. Talk to them. Do they take showers or hot baths? You want to avoid hot baths. So patient education is really, really important. At the same time, I want to tell them use lukewarm water when you're bathing the kid. And you want to apply these lubricants immediately after coming out. So you want to apply them while the skin is still moist. You also want to consider secondary infection, consider MRSA, so maybe giving them Mepirsin ointment as well will cover this, and a cephalosporin such as Keflex can also cover for that. But that's pretty much it, guys. You're going to see this a lot. Just wanted to touch base on this. Leave a comment if you got anything to add to this. I'd like to hear from you guys. It's your boy, Be Rich. I'm out.